Hashimoto's, the diagnosis of it might seem like the answer to what your problems are, but technically it's just a label. And that label is going to mean all these different symptoms, whether it's fatigue or weight gain or just cold sensitivity, hot sensitivity. All these different problems can arise with Hashimoto's and thyroid conditions. And we don't want you to be on this roller coaster that's going downward. So I'm Dr. Chris Cormier. I've been in practice for decades, and we've helped people just like you with methods that you probably never heard of. So right now we're going to have a conversation about these methods so that you can start to open your brain to possibilities on how your body functions and what it's capable of.
Today I'm here with Dr. Chris Cormier, and we're going to be talking about Hashimoto's and other thyroid conditions. Hello, Dr. Cormier.
Hey, Cameron.
When people come to you with Hashimoto's, what do they say still doesn't make sense about how they feel?
So there are a lot of different symptoms when it comes to the thyroid. First and foremost, it's a thyroid condition, right? And the thyroid, it's so involved in temperature regulation. It's so involved in your metabolism that obviously when it's not functioning properly, you can get weight gain, you can get fatigue, you can be sensitive to cold, all these different things, maybe numbness in your hands. And there's reasons as to why. I guess we'll get into the rationale. But those are symptoms that people start to get progressively, and oftentimes it's confusing because they don't know what they have.
At that point, what are they most afraid of being told or not told by another doctor?
I guess that they have a thyroid problem in general, because it's a scary thing. Your thyroid, people hear of it and like, oh my goodness, I had my thyroid removed. All these different conditions can happen. My wife, and I'll use this example, but both her sisters and her mom had thyroid cancer. So, and this is before I got into doing this stuff that I do now, in helping patients the way we do now. I had to learn it and had to go through this experience, but this is many years ago. And so we went and had an ultrasound on her thyroid to make sure she was okay, whatever. But they saw some cysts. So they were like, yeah, let's do a biopsy, right? So we went and did the biopsy, and a couple days after, her thyroid blew up in one of her lobes. It was the size of a baseball. I will never forget the morning, woke up and she did like this, and it was just like massive. And keep in mind, like both your sisters and your mom had all had thyroid cancers. So we went and had the thyroid removed. And I talked to the surgeon before and I said, look, can you please keep the other lobe in? Because it looked good. And he cut the lobe out that was bad. And then right after that, we got to fix this. We got to figure out what's going on with that thyroid and why it got deficient. Yes. And then how can I help my wife, right, get this better? So I've figured out this newer method that we're doing now. And luckily, without getting into the details, we'll explain a little more, I guess, as we go. But I was able to connect the thyroid again. And she's never taken a thyroid med. Wow. This is many years. It's been really cool.
Wow. Why does Hashimoto's symptoms come and go instead of improving steadily?
So again, let's go back to the brain. Let's think about the brain, because I'm always going to go back to the power company. This thing is the most important thing in your entire body. Your brain is, obviously. That's why there's no headless humans. It doesn't matter how big you are, where you're from. Somebody gets rid of your brain, you're out. Okay, so your brain, think about it. It's wired to all your cells, including your thyroid cells. So imagine how cool that is when you think about it. There's a nerve that comes off here that's one of the primary nerves. It's the C7 nerve. So you have 7 cervical vertebrae, but you technically have 8 cervical paired nerves, which is another geek moment, but sorry about that. But it's 8 nerves, but there's 7, the 7th nerve on both sides wraps around and it powers up your thyroid. So when that nerve is connected and the energy flows good from the brain to the thyroid, of course the thyroid's going to function better. But when the thyroid is not powered up properly, it will lose its ability to function. And that power, just like your house, let's say you're in your house right now and you have some lights flickering, maybe they turn off and come back on. Well, that happens in our bodies, and it happens due to stress. So it could be a physical stress, it could be an emotional stress, it could be an environmental stress that you're going through right now that you don't even realize sometimes. And it could be turning that power off or making it go in and out, and that's what creates these symptoms.
Why do people still feel exhausted, foggy, or inflamed even when their labs will appear fine?
Yeah, so the laboratory testing is just going to test the blood. And we're looking, what I just mentioned, the connection between the brain and the thyroid, that doesn't show up in a blood test. You have to know exactly what to do. And so maybe the blood is fine when they're doing it, when they're doing the testing, but maybe the connection is faulty to the thyroid.
Many patients are told, your thyroid numbers are normal. Why doesn't the body feel normal?
Exactly what I just talked about. When your power company loses power to the thyroid, and one thing I didn't mention to you, another nerve that's really primary to the thyroid is the vagus. So the vagus nerve starts back here, goes to your tongue, makes you talk, but it also goes through each side of your neck, and it spiderwebs into all your organs. In addition, your thyroid's one of them, so it's powered up by the thyroid. So these nerves, right, if they're not, it's very similar to talking about a light in your house. If you look at that light, well, you could trace it back to going through the outlet, and what breaker does that outlet go to, and that power company is sending power to that breaker box, right? So it's like trying to figure out and trace what nerve is off, what breaker's off in the body, and then trying to fix it.
What early warning signs does the body give that are often brushed off or ignored?
So fatigue, sensitive to temperature, maybe just some numbness in the hands. Oh, keep in mind, the C7 nerve we talked about that goes to the thyroid, it also goes to this section of the hand. It also goes to the tricep where it pushes your arm down. So it's really important. So some people will get symptoms in the hand where it's maybe some numbness or tingling, and they kind of just, oh yeah, I just have that or whatever. But it can be, they could think maybe it's carpal tunnel or something like that, but a lot of times it could be something related to the thyroid.
When someone with Hashimoto's walks into your clinic, what do you notice right away that blood tests don't show?
Well, that's exactly what we talked about. We look at the person as a whole. So we're going to go do a full history where we look at all the physical stresses, emotional stresses, environmental stresses that they've been through in their life, so that we can understand what those cells have been through. And then we do a very detailed neurological exam where we're not just going to examine the C7 nerve. And so your brain is here, there's 88 primary nerves, 44 pair of them. We're going to test power to each one of those main nerves in the body and see what percentage out of 100 that you're powered up. And like I said, most patients come to us in the 30s. When it comes to the thyroid in particular, when the power supply to the thyroid is not good and the thyroid's not been functioning for a long enough period, that makes other things, other nerves, other breakers in a breaker box trip. And so a lot of times people that have had long-standing thyroid issues end up having multiple spots outside of just the wiring to the thyroid.
Why does the body stay stressed even after thyroid hormones are replaced?
In the body, when you're getting any kind of outside stimulus to the thyroid, instead of your body doing what it's designed to do, it's like your body, it's not those hormones. If you're getting them and taking them, whatever, if you're taking those meds, your body should be producing those things. And your DNA produced everything in your body that your body produces has your DNA match. So when they're giving you something that's an artificial type, it doesn't exactly match your DNA. And it's not giving you, your body should be producing, let's just say, hormones on demand. When you need X amount of T3 or T4, your body should be producing these things. But when your body is not properly connected, then you can't produce these things. And then you start to get the pills where your body gets dependent on, it's just not the same effect as if your body was producing its own stuff. So we try to get your body to connect again to these glands so that your body can start producing what it's designed to produce.
What starts to change when the nervous system finally feels safe enough to settle?
People feel so much better. Their energy is restored. They're not as fatigued. Their weight comes off a lot of times, and they can do things without needing the medications. Again, I'm not here to tell you, I can't tell you not to take meds. So as we start working with a patient, let's say they're on thyroid medication, if they start feeling better, they go back to their medical doctor, whoever prescribed the stuff, and they 9 times out of 10, we see cases where they lower it or get off of it over time just by connecting these parts and getting them to function again.
Amazing. Hashimoto's is called an autoimmune disease. How often does that label explain what really is happening, but not why?
So remember, Autoimmune conditions, any autoimmune is going to go back to dysfunctional cells. The way I explain the autoimmune is different. Conventional is going to say the immune system is erroneously attacking healthy cells in a thyroid. And that's what their definition of autoimmune is. Well, my definition of it is the cells in the thyroid are unhealthy. So the body gets scared and it starts trying to kill off these unhealthy cells. So from our perspective, the way we try to fix it is we want to restore health back to those cells and get the body healthier, where it can do its job again and not be lifelong dependent on some medications.
In your experience, how often is Hashimoto's or any thyroid condition connected to long-term stress on the nervous system?
Virtually all conditions are related to this when you think about it, but especially the thyroid. We're in Louisiana here, and the temperature one day might be 30 degrees, and the next day it might be 90. So it's such a wide array. So of course, we can get just the environment, just that one thing, the temperature fluctuations can cause this issue, but there's other issues that lead to it, right? So you have foods, you have drinks, you have anything in the environment, chemicals, all those things can turn off power to the thyroid. In addition to physical stresses, it could be a whiplash. We have one of our employees that has diabetes, and she developed it after getting whiplash. Again, she was totally fine, athlete, everything before, and then after a couple of years after having that bad collision, she had a broken bone in her neck. It was bad, but that C7 nerve is here. So whiplash can oftentimes affect that C7 nerve and make it weak. Within a couple of years, she had a bad condition, and it got out of control.
What happens when treatment focuses only on the thyroid and not the whole system?
You're going to miss a lot of the problem. So in other words, your thyroid may look normal to whoever is managing your thyroid, but this condition requires the whole body. You want to make sure that everything else, the pituitary, the thyroid, the hypothalamus, all the endocrine glands, they're all working together as a baseball team. And you want to keep the brain connected to all those glands so that they're working for your metabolism, for your temperature regulation, for overall energy. You want all those glands to stay connected as possible. And that's why we do head to toe holistic approach, where we get into the brain, figure out where it's disconnected, and try to keep it connected.
Why can symptoms continue even when the immune response is being suppressed?
So from the conventional side, instead of actually fixing the unhealthy cells, like we talked about in autoimmune, they just try to suppress the immune system. And in my opinion, that's not the right route, because when you suppress the immune system, of course, you're more, you have a higher probability you can get infected by something else. So maybe they think from that perspective they're trying to help, but my perspective is totally different. Fix the unhealthy cells and not worry about the rest of it.
You work with frequency-based therapies in Hashimoto's and autoimmune cases. What is the body actually responding to? Frequency
is one of my favorite things. Einstein said many years ago that frequency is going to be the future of medicine. He was exactly right. And so frequency, each cell in the body has its own respective tune, like guitar strings. And so I'm not a musician, but like each string, when you pick the string, it has a certain tune. If it's not tuned up properly, a musician's going to go and tune the string back up. Each cell, like your thyroid cells, have a different frequency or tune than your heart cells, than your small intestine cells, than your tibia cells. All the cells in the body have different tunes. If the cells in any part of the thyroid lose their tune or frequency, then they can't do their job. And so we have all kinds of ways of helping to reset the frequency. Not only do we have ways in our clinic, we also have devices that people can use for home to help reset the thyroid. Yep.
Wow. Why are people with Hashimoto's often sensitive to aggressive treatment or constant protocol changes?
With any type of condition, the longer unhealthy cells have been there, that leads to more unhealthy cells throughout the body, and that leads to a person that's weaker. And the less connected the brain is, the weaker that person is, so they can't handle. If I went and put a 100-pound dumbbell in their hand, they can't handle it. And that's just a visual example, but you can imagine if I went to them and we worked on their nervous system for 10 hours, they can't handle it. Oftentimes they can handle 10 to 15 minutes of me making corrections, and turning on certain nerves.
What happens when the body receives signals it no longer needs to fight?
So the body is designed to heal itself, and it should heal itself of just about any condition. When it stops healing itself, it's lost the actual signaling to the brain. So there's an unhealthy cell somewhere. Just imagine if it's here in your thyroid. Well, that thyroid, those cells, if they're 100%, 80% connected to the brain, they're going to be pretty healthy, doing their job. But when that signal gets lost and they start to get unhealthy, they start to have problems, they're not going to do their job anymore.
We've seen public figures, including supermodel Gigi Hadid, talk openly about living with Hashimoto's. Why doesn't success, money, or access make this easy to manage?
I'm assuming that most people watching this probably have never heard of what I'm talking about, but it's science. All of what I'm saying is science, but it doesn't involve drugs. And from our perspective, we're doing the reverse. We're trying to keep you away from needing drugs, injections, surgeries, right? Especially in this condition. So, but you can imagine everything out there is censored. So if the drug companies have a lot more money than I have, and they're marketing, they're advertising, they're spending billions of dollars a year doing what they're doing. Imagine if I went on a campaign and talked to you about this and spent billions of dollars a year, it would all get censored. So they wouldn't let me say a lot of what we're saying, but it's the truth. The C7 nerve back here powers the thyroid. The vagus nerve powers the thyroid. It's very similar to walking in your breaker box and seeing exactly which breaker goes where the wiring goes and what it does. And when it's not functioning properly, you got to get it to function.
In your own clinic, what are some of the more severe or stubborn Hashimoto or thyroid cases you've seen, and what do they tend to have in common?
Yeah, so many people over the years, I can't even tell you how many people we've seen where we've been able to reverse this particular condition and gotten them off of their thyroid meds. Again, just to clarify, I can't tell you to not take it, but as their symptoms, as we get things connected again, they're able to function. They get their life back. We've had so many young women, moms, can't even tell you, there's so many examples where they develop this condition and they don't know what to do. And we start to do everything we're doing and fixing things, and their symptoms just go away, and they go back to their doctor who prescribed the stuff, and they don't need the medication anymore. So it's completely possible with this condition to do that. There are some cases where they've been on the medication for so long, maybe we're not able to turn on the thyroid all the way, but they're able to lower what they're doing, and overall their body just feels so much better when the brain's connected better to the cells.
What do both public and clinical cases reveal about the limits of treating numbers instead of systems?
Yeah, so from the conventional side, they're gonna this whole thyroid thing is a lot more popular now, meaning there's a lot higher incidence of having thyroid issues nowadays than there's probably ever been. And there's so much reasoning as to why, right? We could just talk all about just the food industry and the chemicals that are out there, because they want you to eat the cheapest foods that have the most chemicals to make you the sickest, to take the most drugs so that you go to use your health insurance. But from our perspective, we're trying to get you off of that. We want you to do God-made foods. We want you to connect your brain to your cells. We want your body to be self-healing at a higher level where it needs to be. And we want you to not need to go into this sort of stuff. So we want to change the way things are going. Instead of this thyroid problem climbing, we want it to decrease, and we want the body to heal itself.
If someone has been told that they have Hashimoto's or a thyroid condition and that it is lifelong, what assumption should they question first?
So it's not. It doesn't have to be.
Yes.
If you do the right things with any condition, this applies to any condition, especially in this one. If you do my wife's a good example. If you do the right things, she has never taken a thyroid medication. We're talking right now, I guess we're in 2026 doing this video. I think it was around 2007 or 8 when this condition developed, and she's never taken one. So anything's possible with this if you do the right things. Anything's possible. But definitely when somebody says you have a thyroid problem, it doesn't mean it's a lifelong sentence.
Yes. What keeps you working with Hashimoto cases that others have labeled as managed?
We never give up. We always, when it comes to these cases, we're always learning. So as somebody starts to work with us, each person's different. So each person, you may have certain stressors that affect you that don't affect me, that affect somebody else and not somebody else. So as we're working with a person, somebody comes to us and we may make one discovery. I made so many discoveries on my wife. It helped thousands of thyroid people, problems with people. So that's the way I look at it, is every person coming to us, we're able to, even if it's somebody that we're struggling to help, we still are able to change and find new discoveries that might help another 1,000. That's the way I think about it.
What is the most damaging sentence someone with Hashimoto's or a thyroid problem can hear early on?
That it's permanent, that it's never going to go away, that you're going to always need medication, that you're going to potentially have to remove it, like my wife. I mean, you have to remove the thyroid. Luckily, in her case, we were able to keep half of it, but in her case, like, think about it. She kept half and it's never taken a med, and that can totally happen. The body is fully capable of healing itself. You just got to do the right things.
Yes. Well, that is it for today, guys, on Hashimoto's or any other thyroid conditions. Thank you very much, Dr. Cormier. That was very informative.
Thank you. So if you're somebody out there with Hashimoto's or thyroid conditions, I hope that you enjoyed this interview, because we're really trying to educate you on how the body's made and what's possible, and that you don't have to go on this nasty roller coaster that's going downward of just symptoms, more medications, and just not actual solutions to the deep-rooted causes of your problems. We have body chargers that we have for home, where we have all kinds of methods and devices to be able to help you with this particular condition at home. And if you want to dive deeper into this condition, come to the Nerve Health Institute, where we can help and just dive deeper to be able to fix a lot of the problems associated with your thyroid. And so remember, this condition is very popular. A lot of thyroid conditions out there that people have, and we can only take a limited number of patients, but we'd love to help you.